Okay, Pellet Multimedia Berhad is actually a technology-based company. It was incorporated in the year 1997, so about 20 years now. We started off with network, and then we moved on to software, and now we're also doing product design. Our latest IoT development, as was mentioned by Sukhdev in the opening speech, is development set to revolutionize the healthcare industry, our iMedic app. Okay, IoT and connected healthcare. I'm sure all of you will agree that the landscape of healthcare is changing nowadays. You know, what used to be a very messy major procedure those days, now you can actually do in probably a day and get discharged within the day itself. Take for example, if let's say you have a blocked artery. Those days what you had to do was that you had to do a bypass. You had to cut open, you had to get another vessel from probably the legs and to connect it so that the blood can actually travel through that vessel. But now we have stents. With stenting, it makes things so much easier. All you got to do is to put the tube through the side of your leg, and then through the monitor, you can actually transfer the thing slowly up to your heart, and then you balloon up the stent. And there you have it. Instead of having a bypass, which then you will take a long time to recover from, now you can actually be discharged within the day itself. Right? So this is what advances in technology has done for us. So where does IoT come in? Let's look at some of the advances in IoT in healthcare. Well, we have workflow optimization and inventory management, which is already in place. For example, let's say you have the pharmacy, you have the stocks. So each time there is an output, it will automatically alert the system to put in an order. All right. Let's talk about ingestible sensors. This is the more interesting thing. I'm sure all of you have seen, links shared by your friends about sensors that you can ingest. It actually goes in, it takes pictures of your insides, and then it's all on the screen for the doctor to look at and for the doctor to diagnose. Interesting, right? Don't you think? Imagine swallowing a camera. All right. Next thing is the implantable tracking devices. Okay, for this, there is actually a new project by one of the pharmaceutical companies, Roche. I'm not sure if any of you are taking any of the medicines. Alright, they have this diabetes tracking sensor where you swallow it and it will go in through your body, it will measure your blood glucose level, and it will tell whether you need to take in more sugar or you need to cut down your sugar at that time. And it will also measure whether you have already taken your medication or not. I'm sure that a lot of us have got busy schedules, taking medication sometimes slips our minds. So with this kind of thing, imagine being able to be pinged on your phone saying that, hey, it's time to take your medication. Right.
Is it, if you are actually eating up the sensors,
yep.
How is the data coming out? I mean, is it wirelessly to your phones? How is actually what is the medium?
Yeah, it's wirelessly.
Wirelessly means that we have a wireless module that in the sensor that we actually eat for this
Yes, it's actually coated by something that is activated by the electrolyte. So when you swallow it, it goes to the stomach, the acid dissolves the coating, the electrolytes activate the ingredients inside, and then it detects.
Oh, so yeah. It is actually very interesting that you are actually swallowing something, a wireless device, yes. Right, in your tummy, and actually people actually let you do that.
Yeah, it's actually already used in like the US and all.
Okay, it's a new technology which is actually safe.
Yes, approved by the FDA.
Yeah, because you
are not by me, but by the FDA. So.
Alright, so it's actually a wireless module that actually transfers. Is it a wireless, a Wi-Fi? Or what is the...
Well, the details itself, I think we have to ask Roche.
Alright, okay. Right. Very interesting.
Yeah, thank you for your question.
Right.
Okay, let's move on. Medical device integration. This one, we are talking mainly about within the hospital itself, when you go for your scans and everything. The results will automatically be uploaded to the system in the hospital. And then the doctor can access it via his computer. The staff can access it via their computer, so it's all throughout the building. All right. Talking about home medical devices, Sukdev has already touched a little bit on this. Let me just show you some examples. This device is a blood pressure monitor. It not only measures the blood pressure, it incorporates some TCM technology. So what it does is that it measures 11 parameters of the heart. To us, these numbers might not mean anything, but to the doctor, a combination of them, or anything that is out of range, will tell them what is wrong with you. It could be just high blood pressure, it could be something called arrhythmia, where your heart skips a bit. With all this data, the doctor will be able to monitor you when you're at home, and he's in the clinic, or he's at home, or traveling elsewhere. Okay, speaking about that, I've already touched on the remote monitoring. Let's look at the current healthcare healthcare model. For now, the patients have to be physically in the hospital or at the clinic to receive consultation. You know, we cannot say that we feel not well at home and then, all right, how do I get the doctor? I can call the doctor or I can text the doctor. No doctor is going to pick up your call. All right. Next thing is that for those with chronic diseases or those who have ongoing medical consultations, you have to bring your files, you know, all your medical records, all your scans to the doctor's clinic. And you can't just bring your CD, you actually have to bring out the actual X-ray files. Okay. And for those with chronic diseases, some of you might actually experience symptoms that are precursors to a major medical event. For example, let's talk about a heart attack. You don't feel pain before a heart attack happens. You just feel tightness, you feel short of breath, and most of us will actually brush this aside and say that, oh, maybe I worked a bit too hard today. Maybe I walked up that flight of stairs. And then they brush it aside, and in a couple of hours, the heart attack happens. And by then it's too late. All right. Next one is that some families of elderly patients may actually find it hard to follow the progress of their parents, their grandparents. You know, most of us are working in the city. Parents are usually back in the hometown. So imagine with our busy schedules, do we actually have time to call our family every day to ask about their progress, or even every week, or even every month? No, right? With the progresses in IoT, you can actually now do that, because all of your family's data can be synced to your own app, and you can actually keep track of all of this. All right, let me explain a little bit about this. The hospital is actually where we get all our consultations, our scans, our procedures, okay? And with that, there is only a limited stay. We've all got to remember that, you know, major medical events don't happen overnight. Take, for example, the heart attack, the stroke. What are the precursors to that? It's usually high blood pressure, diabetes, high cholesterol, and all of these are built up over time. It's not a 1 month thing, 2 months thing, it's not a 3 years thing, 5 years thing, it's progressive. So this is where we come in, during the incubation period. For anyone with a chronic disease, it's actually very important to be monitored to prevent the major event and to prevent the hospitalization. Okay? Let's look now at the recovery period. Assuming that the stroke happens, the heart attack happens, you enter the hospital, that's where you get your treatment. Okay, you stay 14 days, and then they discharge you. Why do they discharge you? Is it because you're fit to go?
No.
No. Exactly. Or your insurance ran out. Yeah. What's the maximum number of days that you can stay in the hospital? Not many, right? It's definitely not enough for recovery. So it's very important actually to monitor yourself after the procedure. Think of it. When you're in a hospital, you get everything. The nurses come in every couple of hours, they take your vitals, they make sure that everything is stable. The doctor comes in once or twice a day, has a look at you, says you're okay, or says that, oh, you know, maybe your medication needs to be changed, needs to be upped. Then you go home. Everything stops. What happens next? What if you feel uncomfortable when you're at home? What if you feel pain? You feel tired, you feel weak? Who then do you turn to? No one, right? You'll actually have to go to the hospital the next day, or the day itself. You have to take a number, you have to queue up, to wait for your turn, see the doctor, and that is only when you get your consultation. How about getting it right there at your home when you're feeling it? All you gotta do is to take your vitals. If anything at all is out of range, it will be pinged to the doctor's app, and the doctor will be able to tell you, hey, I think you're in serious trouble, you need to come in right now. Or hey, don't worry about it, a few things are out of range, but you'll make it through, it's okay. Just gotta rest more, take this medication, or exercise a little bit. Okay, let's look where IoT comes in, alright? Now we have the patient. We have the patient app. We've got all the connected devices, a BP machine, an oximeter, a CPAP machine, whatever that you need. You have reminders for medication. It can be set by your family, can be set by the doctor, can be connected to your family members. They can all keep track of your progress. And I'm sure all of us have got a connected device somehow, a Fitbit. Most of us are into healthcare nowadays, into fitness. We have so much data, we collect so much data, but what do we do with it? Nothing. We cannot interpret it, we just know that we need to walk a certain number of steps a day. Probably we need to get our heart rate up 2 times when we're exercising. But other than that, we don't know what to do with all this data. This is where we come in. We actually connect you to the doctors so that the doctors are the ones in the background looking at your data and deciding what it is that you need to improve about your life. As shared by the other speakers earlier on, now also with the M card, for machines that need calibration, you can actually include that as well, and the doctor will be able to do it from their clinic, and all you gotta do is stay at home. You don't have to bring the whole SD card all the way to the hospital. Okay, let me just run through a little bit about the app, iMedic. We have got over 10 connected devices right now, including major brands such as Omron, Microlife, MySense, and so on. In the center of it all, the device that takes 11 parameters. Okay. With iMedic, you have your entire history of medical reports all in one place. You have your blood records, you have your scans and everything else. It is accessible on mobile devices. It could be a phone or it could be a tablet. Might be easier to see for elder folks on a tablet, especially if you're giving it to like your grandparents and elderly parents. The beauty about all this is that you can actually get your doctors from anywhere in the world. Anywhere at all. You could be here, but you could get your doctors from the US, from China, from Japan, from Singapore. And let's talk business sense. For these doctors, they can also get patients anywhere in the world. So they don't really have to just depend on patients that walk into their clinic. Right? Another thing is that they can actually do joint consultation globally. So perhaps you're seeing a number of doctors. You walk into the hospital, you have to queue up for Dr. A. And then when you're done with Dr. A, you have to queue up for Dr. B. Right now, if let's say you were to get 2 doctors to look after you via the internet, then you have 2 doctors simultaneously watching your vitals and alerting you and advising you once anything is out of range. Okay. Right now we have about 800 over items of digital medical records. This is including your blood tests, your biochem tests, so maybe your sodium levels, your glucose levels, and so on. All right. We can also integrate X-rays. We can integrate MRI scans, CT scans, and through the app also you get the doctor's diagnosis. And now with medical mobile devices, you can actually monitor yourself from home. This is a summary of what I've been speaking about. So now with IoT and with iMedic, it enables remote monitoring from anywhere in the world. You can get doctors anywhere, you don't have to walk into the clinics, doctors can get patients anywhere. It enables better treatment outcomes because regular monitoring will actually be able to get you to capture anything before the major medical event happens. It also gives the patients the responsibility to be more involved in their health. Because the doctor can tell you a lot of things, but if you yourself don't take control of your health, you don't make the effort to change your lifestyle, you don't make the effort to take your medication on time, nothing's going to come out of it. Alright, it also enables a more complete patient management, where patients will be alerted by the system if anything is out of range. Doctors on the back end will consult about what it means, and also step down care after a procedure to ensure that nothing goes wrong and there are no complications. Alright, let's look at this also from the business point of view, how iMedic can enable generation of additional revenue. Oops. As mentioned earlier, everything happens in the hospital. Also, only revenue is generated in the hospital. So for the hospital, this means new revenue when it comes to management of patients with chronic diseases. And also for complication management after discharge for step-down care. You might think that perhaps having something like that might replace doctor visits. No, it doesn't. Because at the end of the day, face-to-face always means more compared to things that are done over the app. If let's say the doctor catches anything that goes out of range, and he thinks that it's very important for you to come in, he will say, hey, come in. Let's look at the average patient with high blood pressure. How often do they go in to see the cardiologist? Once, twice a year? So that's probably about 500 ringgit out of a patient. Alright, now with this, in the subscription model, it's going to be 12 months. 12 months. So, assuming that one consultation is about 250 ringgit and they charge that per month, it's going to be 12 times. 12 times instead of 1 or 2 times. It also enables horizontal and vertical growth in terms of value-added services. That is for existing patients. And also, now they can obtain new patients via medical tourism, because now everything is outside the boundary of the hospital. Alright, we are currently working with hospitals, with individual doctors themselves, and also with nursing homes. And we are very proud to actually launch our first medical mobile hospital, which is HSC Medical Center. Future deployments will actually to be taught to businesses, HRs, to actually introduce this as employee benefit to their employees, so that the employees will be able to take their health into their own hands, live a more healthy lifestyle, be more informed. And also we're planning to talk to health insurance. Yeah. So that signals the end of my presentation. Sleep better knowing that someone is watching over you. Thank you.